cure them, treat them, early detection for cervical cancer, breast cancer, oral cancers, tumors. They've been able to, I think, tackle those cancers better. But cancers concerning the blood and the bone marrow, leukemias, these are all been more challenging, and advanced stages of lung cancers, all that. So the challenge is there, and now that the cytotron technology has been another invention that has been done by our Dr. Raja Vijay Kumar. So I think this is something which really might be a great scope. There's a lot of scope for hope and optimism, because these kinds of technologies are coming about now. And how it can work, and I'm not an expert, and I think there are a lot of experts who have come over here and who are in this field of oncology and cancer and all that. And it is for you people to really make a assessment of how this cytotron technology can be used to really benefit the cancer patients. But we should always encourage new ways of doing things. We should always encourage new research, new technologies, new ideas, and that is the way forward. And as a government, for us, definitely Karnataka is one of the progressive states in this country, and for us cancer is a priority. We have some of the most premier government cancer institutes in the country is there in Karnataka. Our Kidwai Cancer Institute, which was established in 1970s itself, is a cancer research center, and is treating lakhs of people, has treated lakhs and lakhs of people in our state. We have a very big institute in Bangalore, and we've got peripheral institutes across Karnataka in about 4-5 regions of Karnataka. We're expanding this Kidwai Cancer Hospital all across the state. But ultimately cancer care is always a high-end care, and private sector plays a bigger role here, and they are able to invest more, and they're able to, I think, they're extremely very good hospital facilities in Karnataka, Bangalore, in India, where cancer care and cancer hospitals are there, and I think there is no dearth of good technologies and good equipment, international standard equipment, all that. The LINAC and the various other precision robotic technologies, and using the laser treatments, and all kinds of things are there, and various ways of detecting, and high-end detection equipment, like that. So it's something that all of us, the state and the private sector, both are working towards it. And today's initiative, I'm sure, is another step in that direction, to see that how innovative people who can think through things and can come out with solutions. I think that is what has been the force behind the Cytotron. So a round of applause to our inventor for having come out with this. It's not easy, and these are not things that will get accepted so easily. The medicals, in the modern medicine, modern medical practice, it is so much, it requires so much of authentication and so much of research work, and that should be tested, tried, and various trials. So it's not easy to have, to be able to come out with a breakthrough and to be allowed it to be authenticated and standardized. It is not easy, and I think that's a fantastic job. And now that it's being put to use now. I think that's the step now, using use of cytotron technology in our hospitals. I think Akshaya Hospital has come forward. Also, they are also using this cytotron for cancer care, and the other organizations who are here, GLIA and organization D, Scali. So all of them are backing this. So I'm sure this will really be able to make a mark and an impact. And I hope that this will be another addition to the growing needs of cancer patients, because cancer is a growing disease. More and more people are getting it due to various reasons, due to environment, due to genetics, due to longevity, due to habits. All these things are causing this dreaded disease.
My name is Dr. Raja Vijay Kumar. Today's program, what was held here, is really nicely done, and it was to bring out the new modality for cancer, which has come of age, is the Cytotron therapy, or what we call it as RFQMAR FRB therapy. This is a new type of cancer treatment where it uses techniques of cytostatic method of controlling cancers, unlike the other presently available treatments. It's going to definitely make a lot of difference in the cancer care. It is going to complement many of the existing treatments also, and give a better quality of life. That is what we are looking at for the cancer patient. It's not very important as to how long you live, but it is very important as how well you live. So, taking all this into consideration, I think this treatment will be taken very well, and more people should get benefited. So, as an inventor, I would have done my duty. Thank you.
I think this has taken care of all the side effects of...
Not an improvised version of any of the therapies that are there. This therapy is a totally different therapy. That is why it is called the cytostatic therapy, or cytostatic means this therapy does not kill good cells or the cancer cells. It only stops the cancer cells from growing further and spreading. Most important is, in cancer patients, when the cancer grows, it interferes with the function of the body, and second important thing is cancer spreads. So with this treatment, as per the publications, in about 90% of the patients who undergo this treatment, at whatever stages they come for this treatment, the cancer does not spread further. So that is a great advantage. ಒಂದು ಟ್ರೀಟ್ಮೆಂಟ್ ಬಗ್ಗೆ ಇತ್ತು, ಸೈಟೋಟ್ರಾನ್ ಅಂತ. ಸೈಟೋಟ್ರಾನ್ ಟ್ರೀಟ್ಮೆಂಟ್ ಬಂದು ಈಗ ಇರೋ ಟ್ರೀಟ್ಮೆಂಟು ಕ್ಯಾನ್ಸರ್ಗೆ ಅದ್ರ ಜೊತೆ ಅಥವಾ ಇದು ಮಾತ್ರನೂ ಹೆಂಗೆ ಬೇಕಾದರೂ ಈ ಟ್ರೀಟ್ಮೆಂಟನ್ನ ಯೂಸ್ ಮಾಡ್ಕೋಬೋದು. ಇದೊಂದು ಮತ್ತು ಇರೋ ಟ್ರೀಟ್ಮೆಂಟ್ಗೂ ವ್ಯತ್ಯಾಸ ಏನು ಅಂತಂದರೆ, ಈ ಟ್ರೀಟ್ಮೆಂಟು ಕ್ಯಾನ್ಸರಿನ ಮುಂದಕ್ಕೆ ಬೆಳೆಯೋದು ನಿಲ್ಲಿಸುತ್ತೆ. ಯಾವ ಸ್ಟೇಜಿಗೆ ಬಂದ್ರೇನೋ ಅದಿನ್ನು ಮುಂದಕ್ಕೆ ಬೆಳೆಯೋದು ನಿಲ್ಲಿಸುತ್ತೆ. ಎರಡನೇದು, ಇದು ಈ ಟ್ರೀಟ್ಮೆಂಟನ್ನು ಕ್ಯಾನ್ಸರನ್ನು ಹರಡೋದು ನಿಲ್ಲಿಸುತ್ತೆ. ಸೊ ಕ್ಯಾನ್ಸರ್ ಅಂತಂದರೆ ಇದು ಎರಡನೇ ಮೇಯ್ನಾಗಿ ಇಂಪಾರ್ಟೆಂಟು ಅಲ್ವಾ. ಸೊ ಅದರಿಂದ ಜನರಿಗೆ ಒಳ್ಳೆ ಕ್ವಾಲಿಟಿ ಆಫ್ ಲೈಫ್ ಕೊಡುತ್ತೆ ಈ ಟ್ರೀಟ್ಮೆಂಟು. ನೋಡಿ, ನಾವು ಇಂಪಾರ್ಟೆಂಟ್ ಏನಂತಂದರೆ, ಮುಖ್ಯವಾಗಿ ಎಷ್ಟು ದಿನ ಬದುಕಿರ್ತೀವಿ ಅಂತ ಇಂಪಾರ್ಟೆಂಟ್ ಅಲ್ಲ, ಎಷ್ಟು ಚೆನ್ನಾಗಿ ಬದುಕಿರ್ತೀವಿ ಅಂತ ಇಂಪಾರ್ಟೆಂಟ್. ಸೊ ಕ್ವಾಲಿಟಿ ಆಫ್ ಲೈಫ್ ಇಂಪಾರ್ಟೆಂಟ್. ಸೊ ಈ ಟ್ರೀಟ್ಮೆಂಟಲ್ಲಿ ನಮಗೆ ಇದು ಸೈಡ್ ಎಫೆಕ್ಟ್ ಅಂತದ್ದು ಏನು ಇಲ್ಲ, ಅಡ್ವರ್ಸ್ ಸೈಡ್ ಎಫೆಕ್ಟ್ಸ್ ಏನಿಲ್ಲ. ಸೊ ಇದು ಭಾಳ ಇನ್ನು ಮುಂದಕ್ಕೆ ಜನರಿಗೆ ಅನುಕೂಲ ಆಗುತ್ತೆ, ಜನರಿಗೆ ಉಪಯೋಗ ಆಗುತ್ತೆ ಅಂತ ಅಂದ್ಕೊಳ್ತಾ ಇದ್ದೀನಿ. ಈಗ ನೀವು ಹೇಳ್ದಂಗೆ ಕ್ಯಾನ್ಸರ್ ಬಂದಾಗ ಜನರು ಭಯಪಟ್ಕೊಳ್ತಾರೆ. ಕ್ಯಾನ್ಸರ್ ಹೆಸರು ಕೇಳಿದ ಕೂಡಲೇ ಅರ್ಧ ಪ್ರಾಬ್ಲಮ್ ಆಗೋಗುತ್ತೆ, ಅರ್ಧ ಎಫೆಕ್ಟ್ ಆಗೋಗುತ್ತೆ ಅಲ್ಲಿಗೆ. ಮತ್ತು ಇನ್ನೊಂದೇನು ಅಂತಂದರೆ, ಕ್ಯಾನ್ಸರ್ ಅಂತಂದರೆ ಅದು ಒಂದು ಪೇಷಂಟಿಗೆ ಮಾತ್ರ ಬರೋ ರೋಗ ಅಲ್ಲ, ಕುಟುಂಬಕ್ಕೆ ಬರೋ ರೋಗ. ಯಾಕೆಂದರೆ ಕುಟುಂಬಕ್ಕೆ ಅದು ದುಡ್ಡು ಬೇಕು, ಇನ್ನು ಮುಂದೆ ಏನಾಗುತ್ತೆ, ಎಷ್ಟು ದಿನ ಬದುಕಿರ್ತಾರೆ, ಏನಾಗುತ್ತೆ, ಇದೆಲ್ಲ ಭಯ ಬರುತ್ತೆ. ಆ್ಯಕ್ಚುಲಾಗಿ ಏನು ಅಂತಂದರೆ, ಆ ಭಯದಿಂದನೇ ಕೆಲವರಿಗೆ ಕ್ಯಾನ್ಸರು ಭಾಳ ಮುಂದುವರಿಯೋದಕ್ಕೆ ಚಾನ್ಸ್ ಇದೆ. ಫಸ್ಟ್ ಏನಂತಂದರೆ, ಕ್ಯಾನ್ಸರ್ ಕೇಳಿದ ತಕ್ಷಣ ಹೌದಾ ಕ್ಯಾನ್ಸರು, ಹೌದು ಆಯಿತು, ಇನ್ನು ಮುಂದೆ ಏನು ಮಾಡಬೇಕು ಅಂತ ನೋಡಬೇಕು. ನಮಗೆ ಬೇರೆ ರೋಗಗಳು ಬಂದರೆ ನಮಗೆ ಭಯ ಬರೋದಿಲ್ಲ. ಅದೇ ಥರನೇ ಇದು ಒಂದು ರೋಗನೇ. ಓಕೆ, ಸೊ ಕ್ಯಾನ್ಸರ್ ಬಂದಿದ್ದ ಕೂಡಲೇ ಅವರು 4 ದಿನ ಇರ್ತಾರೆ ಅಂತಲ್ಲ. ನೀವು ಅದು ಭಯ ಪಡದೆ ನೀವು ಮುಂದಕ್ಕೆ ಹೆಂಗೆ ಅಂತ ಇರೋ ಟ್ರೀಟ್ಮೆಂಟು ಚೆನ್ನಾಗಿ ಆ ಟ್ರೀಟ್ಮೆಂಟ್ ಬಗ್ಗೆ ನೀವು ಏನೇನಿದೆ ಅಂತ ನೋಡಿ ಯಾವ ಟ್ರೀಟ್ಮೆಂಟ್ ಕೊಡ್ಬೋದು ಅಂತೆಲ್ಲ ನೋಡಿ ಸ್ವಲ್ಪ ವಿಚಾರಣೆ ಎಲ್ಲ ಮಾಡಿ ಆಮೇಲೆ ಕರೆಕ್ಟಾಗಿ ನೀವು ಟ್ರೀಟ್ಮೆಂಟ್ ಕೊಟ್ಟರೆ ನಿಮಗೆ ಕ್ಯಾನ್ಸರಿಂದ ಏನೂ ಪ್ರಾಬ್ಲಮ್ ಬರೋದಿಲ್ಲ.
I know Dr. Kumar as a friend about 20 years ago, and he is the one who has invented this machine called Cytotron. To me, the Cytotron is a breakthrough in the treatment of cancers because it uses a device that is safe. It hasn't got any thermal injury, hasn't got any radiation injury. It satisfies the safety profile of any new device, and also a very effective way of treating cancer in a non-invasive way. I think it's a real breakthrough because it uses a very ingenious scientific method of using this fast radio burst waves to bring about changes in the cancer cell to the effect of causing them to naturally die. And that's the kind of end result we want in dealing with cancer cells. We want these cancer cells to die naturally. We don't want them to be bombarded with very harmful chemicals like chemotherapy. I think chemotherapy has its place, in particular the new generation of chemotherapy, the target cell treatment, the immunotherapies. But I think we can use these new therapeutic approaches, treatment approaches, in addition to cytotron treatment, so that we can get the best possible results. So I am very satisfied with the use of this machine to deal with cancers, and it's particularly useful for solid tumors, for brain tumors, for pancreatic tumors, for lung tumors. All these solid tumors seem to be